Our focus today on how the power of philanthropy in the field of health and medicine has saved lives is exemplified by exploring the impact one organization has had, and that is the Breast Cancer Research Foundation. And we will hear its history today from different perspectives, from scientific to personal. For me, this is really a coming together of two institutions that I believe in very deeply. This museum and its mission to educate and preserve history, where we strive to provide connections to history and drive our visitors to active participation in strengthening our world. And today, we indeed cross paths with the Breast Cancer Research Foundation, not just at this symposium, but for our visitors as well. You see, earlier today, we accepted into the museum's permanent collection the artifacts representing the Breast Cancer Research Foundation's vision of a world without cancer. BCRF's story is an inspiring American story, is one that has touched millions of lives and now takes its rightful place in history and will be shared with those who walk through our doors. We are privileged to have with us today Leonard Lauder, who founded the Breast Cancer Research Foundation with his late wife, Evelyn Lauder. He continues to serve today, 25 years later, as its honorary chairman, and I have the honor of serving alongside on the board of directors with Leonard. Few people embody the power of giving quite like Leonard Lauder. Indeed, he is a transformative philanthropist, passionate about philanthropy, and particularly in regard to health and medicine. He is also the co-founder of the Alzheimer's Drug Discovery Foundation. Through their commitment, Leonard and Evelyn have been agents of change, hope, and possibility, and have made an indelible mark on medicine and science, and on the lives of millions. Leonard's and his family's passion for philanthropy continue to inspire others and remind us how far breast cancer treatment has changed since the Lauder family founded BCRF 25 years ago. His commitment to BCRF's story is exemplified by Leonard joining us today on his 86th birthday. Amazing, right? And on behalf of the museum, we wish him a very happy birthday, and let's give a warm welcome to the incomparable Leonard Lauder.
When I told my family that I was going to be in Washington on my 86th birthday, they said, "What are you doing that for?" I said, it's because of the power of giving and the power of one, and what so many great people are doing to support the philanthropy in the medical and arts field. They said, "Okay, we'll celebrate your birthday tonight." I said, "We can't, we're at dinner." "Okay, we'll give you a cake, and you can eat it in your hotel room." So I just ate plum tart. But thank you all for being here, and I want to share with you some things that we did along the way as to how we were able to work and create BCRF, the Breast Cancer Research Foundation. My wife, Evelyn, my late wife, Evelyn, was a master at this, and she had such enormous energy. The first thing she wanted to do, she built the first breast center in New York City. Then she and Dr. Larry Norton decided to launch the Breast Cancer Research Foundation in our kitchen. So, coffee was good, and the coffee cake was even better. And that's the start of history. We decided to underwrite various researchers. Our first researchers, we had number 8 researchers, and we gave a dinner for them in our dining room. Today, we have over 300 researchers worldwide, and they do great things. Now, government support means You have to write a long proposal, et cetera, et cetera. We just go after the right people at the right time. Now, let me pause for a minute and tell you one of the great things about this nation, our United States. No matter what the newspapers say, this is a great nation. Remember that. In 1703, the Massachusetts Bay Colony, if you remember your American history, the Reverend Cotton Mather said that it is our responsibility to do good and do good things. There is no government to support us for what we have to do. Now, I can't quote the whole thing because it was written in Latin, but I'm giving you the translation. It started there. I've traveled the world. Whenever I go to Europe, people say, oh, you know the reasons that Americans support their various places because they get tax deductions. Yes, but no. Why no? Because it is in our souls as Americans that we have to do good. That is in our hearts. Please remember that. And so when someone comes knocking on your door, they are also doing the right thing. So the BCRF, over the many years that we've been there, have reduced breast cancer deaths by nearly 50%. That's an incredible record. Why? Because we just keep on going and going and going. Now, Abbe mentioned my other effort, which is for Alzheimer's, the Alzheimer's Drug Discovery Foundation. That was something started by my brother and I a number of years ago. Why? Because all the money on Alzheimer's was being spent on care, not on research. We decided that we would do only research, and research only. And we are making progress. I promise you that. We now have a joint project between ourselves and Weill Cornell in New York City that looks like it can really help those who have the Alzheimer's gene. Some time ago, a dear friend of mine's father was diagnosed with Alzheimer's, and I said, why don't you be tested? She said, it makes no difference. If I have the gene, I'm finished. We will fix it. We are now working on a project that the earliest tests show that if you have the gene, we can help and we can do it. So that it is the private-public partnerships that is bringing us closer to the cure for Alzheimer's and the prevention and cure of breast cancer. And you will realize that, of course, there are many private people who have stepped in to do other things. That in almost every disease, there is someone who says, that's my mission. So I want to be very short, but to the point. My mission and that of the Lauder family who are involved in both Alzheimer's and breast cancer is to cure these diseases fast. I don't have time to wait around. Fast. And one of the things that we've done is that we have kept the overhead low. The Lauder family pays all the overhead for Alzheimer's Drug Discovery Foundation. Breast cancer, BCRF, the breast cancer research, is down to only a few percentage points of overhead. What we do is put all of our money into research. And you should be proud of what Americans are doing. Americans are doing great things, and let us applaud what the individuals do. Think just for a moment. If anyone is from Seattle, the Fred Hutchinson Clinic, they are the leaders in certain types of breast cancer and of cancer, a cancer of the brain. Everywhere you go, there are names of people so that when you see that person's name, celebrate them and thank them because they are part of us that is making this nation great. I don't wear a red hat, but I'm telling you that our objective is to have America be the leader in research and cure and prevention around the world, and through a public and private partnership. So that is a short message, but I hope an important message, that let's join hands together to make this happen, because I'd like to come back here 5 years from now, if I can, and 10 years from now, if I can, and say, we have cured breast cancer. We have cured Alzheimer's. And my pledge to you is that we will continue to work hard for you because the cure is in sight. So bless you all for being here, and remember this. Let's be with us and never turn back. Keep up the work, and we'll win. Thank you very much.
Leonard really introduced this topic extraordinarily well. We've been around for 25 years. A lot has happened in those 25 years. And I am very grateful to have the opportunity to talk about this. And I would like to actually spend the whole time that I have talking about how wonderful BCRF is and how wonderful I am in terms of the formation of BCRF. But that's not totally appropriate, because I really would like to use my time to use BCRF as an example of what philanthropy can do and why philanthropy is absolutely essential to get these things accomplished. Philanthropy it's about money. But it's not just about money, any more than automobiles are about fuel. Without the fuel, the car can't run, but with just fuel, it doesn't run. And so the question is, what does that money do, and why is philanthropic money so absolutely critical in the whole ecosystem of biomedical research, using the example of breast cancer? The reasons are that you could do things with philanthropic money that you can't do any other way. And that is because philanthropic money is a gift, and is a gift to accomplish a certain purpose, but it conveys to the people who utilize that gift freedom and forms of freedom that no other funding mechanism can really accomplish. Other means, governmental funding, absolutely critically important, for example, and David already mentioned that. And by the way, I noticed that Norton and Norton only differ he's got an SK and I've got an N in front of it, you know, and I think that SK probably stands for Sloan Kettering, so I feel very much at home. But David introduced the topic of how important federal funding is for research, and it is totally important, obviously, and I've been involved in that really my entire career in one way or the other. I trained at the National Cancer Institute. I was on the National Cancer Advisory Board, still involved in governmental activities in that regard. But there's a certain definition of the kind of research that they could support, being specific aims. You have to know what you're going to accomplish, a focus really on the United States, and the application process involves competition, and because it involves competition, we have an army of gladiators, all trying to accomplish the same thing because they're an army, but they're all gladiators, they're all fighting with each other for competitive grants, which creates really a certain atmosphere and also a certain need for achievement at every step. If you have a 5-year grant, you know at the end of 5 years you have that result, so you can't get your grant renewed. So that you have to pick projects that you are highly likely for you to be successful at doing, and those are projects that really are not necessarily the most innovative things, because innovation, creativity fails more often than it succeeds. So you need the opportunity to be able to do things that can fail and still know that you can get funding. So the BCRF started, and as Leonard mentioned to you, in his kitchen with Evelyn, and for a specific need, which was that 25 years ago, a little more than 25 years ago, there was an explosion of basic science about cancer that we were all appreciating was really making enormous strides in terms of fundamental understanding. There was a well-established network of excellent physicians who were not only providing care for patients, but could do clinical trials. There's nationally sponsored cooperative groups, for example, cancer centers that had come together and were working on these various topics. But the glue between the advances in science and the capabilities of clinical medicine and clinical investigation, there was nothing really gluing them well together, and we needed something to glue them together. And out of that, there was the decision to have a dinner party, and the dinner party raised some money, and we supported 8 people that were doing, half of them were doing science and half of them were doing clinical investigation. And from there, the organization really has grown. They were all Americans at that time. But the intention, of course, of this was to basically cure cancer, starting with breast cancer, but cure all cancer, and to do it as rapidly as we could by getting the very best minds involved. When we started, these were the places where those 8 investigators were, or in the next year thereafter, in 1994. And over the 25 years, it grew. And it grew to the point that I can't go back, but it encompasses really 14 countries now, approximately 300 investigators, and throughout the world. So that the global reach is something else. We didn't have to focus in on one geographical area or one city or even one nation, that we could really go global. We could also involve, as you see, they saved me by actually having a back button, which I don't have on my little thing. In this regard, and we intend to expand into other places as well. There actually is a little tiny dot in the middle of Africa. You can't see it. We're studying global pathology by digital pathology, where people can actually have their slides read in other countries that have pathologists, because they don't have them there. And for this, actually, the American Society of Clinical Oncology is going to give a humanitarian award for that activity this year. And we have every intention of expanding to all the rest of the world as the projects really mature in the rest of the world. We were also able to bring together, and this was co-funded, and that's my last topic that I want to mention in terms of the ability to do collaborative work, with the Avon Foundation, that's no longer in that, but also Susan G. Komen, a consortium of major cancer centers, and I think we have 19 now major cancer centers that are working together on clinical trials throughout the United States. And not represented really on this slide is that they have a relationship now with the Breast International Group, which is based in Brussels, which has a very European-centric focus, but also an international focus as well. So there is an organization now that encompasses really the entire globe to do translational breast cancer research, high-technology breast cancer research with strong biological correlates involving clinical trials, and has made an extraordinary difference. So it's been able to really break down the barriers from different institutions. Instead of being competitive for a granting mechanism, they could work together and rewarded for working together to accomplish a common goal. Everybody wants to accomplish that common goal. How wonderful it is not to be competitive with each other in terms of getting the funds to be able to move forward and to accomplish these important tasks. This is actually one of the core operations that allowed us to do something really quite extraordinary, which is to study the molecular biology of metastatic breast cancer. Much of what has been accomplished is about the primary disease in the breast. And in one of the activities that the Breast Cancer Research Foundation has conducted for over a decade now, it's the meeting between this organization and the American cooperative groups and the Breast International Group. We used to meet, alternate sides of the Atlantic. Now we're meeting in Chicago every year, because there's a big meeting that we have there called the American Society of Clinical Oncology, and we meet there every year. And it became obvious that we had a lot of expertise throughout the world in the DNA, RNA, and protein abnormalities in primary breast cancer. But we didn't know very much about what those abnormalities were in metastatic disease, cancer, breast cancers, spread to other parts of the body, spread to other organs. And so just studying this is like trying to figure out why the cows have left the barn by only studying the cows that are still in the barn. You might get exactly the wrong answer. So we needed to get that information. Lots of places were doing this work, but they were doing it in a dissociated fashion. So through an extraordinary gift from Leonard Lauder and matched by other gifts, other gifts that we've received, we were able to establish an AURORA project, AURORA US and AURORA EU, to get samples and to study the molecular biology of metastatic disease. And that work is really progressing rapidly with lots of surprises. And I don't have enough time to give you a scientific presentation, but we're learning things that are totally transforming our notion of what cancer is. Not just cancer cells. It's cancer cells related to other cells in the body, and they have to talk to each other, and how they talk to each other, molecules, is all being discerned now at a very high level of sophistication by essentially everybody in the world who's doing high-level work in this regard, joining together, not competing for grants. I should get the money, you know, not somebody else, but joining together because of the glue of what philanthropy can give to, can enable, so that we can accomplish that extraordinary achievement. To show you some idea of what's happened because of that, when we got started in '93, we knew that there were two kinds of breast cancer that were hormone-dependent breast cancer, where the estrogen receptor could be measured, and hormone-independent breast cancer that was called estrogen receptor negative or ER negative. And we had one targeted therapy for estrogen receptor positive disease. We had chemotherapy then, which just kills dividing cells. And since so many of our other cells in our body divide, there's a whole lot of toxicities associated with chemotherapy because it's fairly nonspecific. We knew then, '93, that we needed targeted therapies that attacked specific abnormalities that are found in breast cancers, in all cancers. And then it had various terms over the years. It eventually became called precision medicine or personalized medicine, but it really started with the concept that we needed to marry our increasing knowledge of the basic biology of cancer, finding molecules that made cancers cancerous, with therapeutic advances, so that we could then target those opportunities. And this is where it started in '93. And this was the discussion we had in the kitchen table, is I've got tamoxifen, which I can use for estrogen receptor positive disease. A few other drugs are coming down the pike in this particular regard. But we know that many other molecules are important in cancer. We're going to have to develop therapeutics for this. It's going to have to start with basic science. It's going to have to start with people working together, you know, to accomplish this goal and this mission. And over the 25 years, this is where we are now. And we can subdivide cancer into at least 5 and maybe as much as 11 different subtypes. There are individual drugs that can attack those various subtypes, that they can be given for the specific patient who has those abnormalities. They can reduce toxicity of therapy because they're targeting only the abnormality found in the cancer and not broadly. And every single one of these advances started because somebody was working in the laboratory with philanthropic support. And then they developed through grant support, federal grant support, other types of competitive grant support mechanisms, eventually reaching commercial development with the amazing mechanism that we have in this country for taking good ideas and being able to develop them into products and being able to deliver it to the patient. But they all started with a bright idea in somebody's mind, and that bright idea had to depend upon philanthropy to actually get started. So this demonstrates really better than anything else that I can show you the fact that we can make progress if we have the ideas and if we nurture those ideas, if we break down barriers so people can work together, if we can form these consortia so that people feel they're working toward a common purpose. They still should compete for grants. Critically important. Federal funding for the grants is critically important and has to be maintained and has to be increased. It is very, very clear that that's a critically important thing that we all have to be behind, but it starts really with philanthropy. And as a consequence of this, this says BCRF's impact. A BCRF person made this slide. I didn't, but it's true. Is that we've got a dropping of at least 40% in breast cancer mortality. The arrow is when BCRF started. You'll notice it's a flat line before that, and then it starts to drop. It's not all BCRF, obviously. There's lots and lots of people who could take credit for this. But I will say that having tracked this, that all the advances that have led to this have all involved a BCRF investigator. And so that the BCRF collection of extraordinary scientists and doctors has been involved really in all the advances, and all of them: imaging, prevention, as well as therapy, prognostication, wellness, survivorship. Every aspect that has really led to this has involved innovative people doing innovative work because they were supported by the ability to do innovative work and then moved on really through the process. So it works. And this is a clear demonstration that it works and why it should be maintained and why the concept is so important. BCRF obviously is important, proud of it, proud to be involved in it, but it's the concept of what you can do when you can encourage people to be creative, to give them the freedom of creativity, to know that they can try an idea out, and if it doesn't work, that they're not going to lose their funding, to know that they'll be rewarded for working together and as opposed to being in a combative mode where they are competing necessarily, that they've demonstrated their achievements. They could be young, they could be old, they could be at the end of their career, they could be beginning of a career, it doesn't really matter. They could be anywhere throughout the world. The important thing is to be able to support them to do these achievements, and that's really what philanthropy can do, and that's why it's an essential component of the ecosystem of biomedical research. So it's not just more money, that's great. It's different money. It's a different way of supporting science and a critically important way of supporting biomedical science. And it works. And it can create great accomplishments that we all can be very proud of. Now, part of that, in terms of where BCRF is going, is an extension of everything I've said before, because it's not just what BCRF could do, but what BCRF could do with other people. I mentioned to you the Translational Breast Cancer Research Consortium, which is all those cancer centers get supported. They have grants, they have philanthropy, but they're all working together because they're glued together. Recently, in the last few years, the Breast Cancer Research Foundation has established a relationship with pharmaceutical companies, and it started with Pfizer, and now Astellas, and others are in discussion, where the company will give us access to their drugs and funding, but the investigators will decide the research that they can do with it, which is not the conventional way that drug companies develop drugs. They design the studies, but they have enough confidence in this extraordinary collection of scientists and doctors that good will come from it, and ideas have come from that could not have come from any other mechanism of support. The international collaboration that we call AURORA is supported by the Founders Fund, named after Evelyn, in the Breast Cancer Research Foundation, and has brought together internationally scientists who are working on the problem of metastatic disease and trying to understand the fundamental nature of this. Our most recent initiative is actually us in collaboration with the Simons Foundation, and Marilyn is here in the audience, because it's about mathematics, and we've decided to call it the Mathematics Oncology Initiative, because that spells bois. It's just an accident. And because this explosion of information that we're gathering from AURORA and in molecular biology laboratories really all over the world. I just came from a National Cancer Institute meeting in Nashville, Tennessee, where I saw an extraordinary amount of data being produced by superb scientists, by a mechanism that the federal government is supporting through the National Cancer Institute. All that data needs to be analyzed in creative ways. And so, knowing the positions of all the stars in the heavens isn't going to get you an understanding of how to build a rocket ship until you have a theory of universal gravitation, which is a mathematical theory which explains the motions of the heavenly bodies, but also enables you to build things like rockets and airplanes. And mathematics has been a key to understanding large data sets really since the Middle Ages. It's just that the mathematics is improving, and computer techniques are improving to be able to use innovative mathematical tools. So we have established really an international collaboration of mathematicians, not just statisticians, not just bioinformatics people, to be able to analyze this enormous amount of data that's being produced in these various initiatives. And we have every intention of doing creative things that I haven't thought of, that I haven't even spoken about. I mean, the important thing is not to say the answer is. The important thing is to say we're going to really look for the right answer and do the right thing at the right time. And we can do that because of the extraordinary power of philanthropy to give you the freedom to be able to move in innovative directions quickly, to move efficiently, non-competitively, collaboratively. It's the power of philanthropy, that's the power of giving. It enables us and our colleagues in biomedicine to be able to do innovative things and not necessarily be stuck really in one area. It's one of my favorite questions I usually get from lay audiences. What's the most important part of cancer research? Is it prevention? Is it wellness? Is it therapy? Diagnosis? I say, I'll answer your question if you tell me what's the most important part of the airplane. Is it the left wing? Is it the right wing? You know, is it the motive force? The fact is, the most important part of the airplane is it all works together and it all works well. And that's exactly the same thing as in biomedicine. And what I just want to convey to you is that my thrill for being involved in an organization that is part of that ecosystem and supports all aspects of research and is very willing to and enthusiastic about collaborating with anybody else who's doing good research to rid the world of breast cancer and eventually rid the world of cancer. That is the ultimate power of giving. Thank you all very much. All right. Now, before I leave the stage, I've got the great honor of introducing Amy Robach, who's been sitting patiently in the green room all this time. We all know her as the co-anchor of ABC's 2020, really primo position in terms of public communication. She's also essentially every morning on Good Morning America, which is where I see her because I'm up very early, and is all over ABC News. An extraordinary individual, an extraordinary person, and very dedicated to the eradication of breast cancer. She's actually an ambassador to the Breast Cancer Research Foundation. Just a few years ago, she wrote a book that was a New York Times bestseller called Better, How I Let Go of Control, Held On to Hope, and Found Joy in My Darkest Hour. She brings joy to many of us who are involved in this task. She's a truly wonderful person, and please welcome her to the stage, Amy Robach.
Hello, everyone. I want to thank Dr. Larry Norton. He has been a rock for me over these past few years. And happy birthday to Leonard Lauder. I was back there with him and didn't even know it was his birthday. So I'll have to see if I can catch him and give him a birthday kiss. It was October of 2013 when I found myself in an unthinkable position. I was sitting in a radiologist's dark room. I had just had a myriad of tests after a follow-up mammogram. Many of you may have seen on Good Morning America where I had a live mammogram at the age of 40 to try and help other women who might have been dragging their feet about making that appointment that many of us don't really want to make, and some of us, myself included, who thought they didn't need to make for at least another 10 years. I was sitting in the office and the doctor came in and she said, "Is there anyone who can be with you right now before I read you the results of the biopsy we took," which I was sure was a benign mass that they had found. And I didn't want to disrupt anyone. My husband was traveling on business, and so I had him on speakerphone. I said, I can call my husband. I'm a logical person. I thought this is just going to be, you know, routine. She's going to say something. I had zero expectations that it was going to be what she said. And she saw my husband's name on the phone. And when I got him up, she walked in and she said, "Mr. Hsu, I need to ask you a question before I read the results." And she said, "Are you driving?" And it was like a bad scene out of a movie. I actually couldn't believe that she was about to say what she said next. And that's when she said, "The mass we found in your wife's right breast is malignant. And I don't know how other people react when they find out that they have cancer, but I fell apart. I was hysterical. I was making noises I didn't even know I could make. I had a lovely nurse, thankfully, next to me, rubbing my back, saying, "I hate this part of my job." And the radiologist was, I think, a little uncomfortable because there was silence on the other end of the phone, and that's when she said, "Mr. Hsu, your wife's not taking the news very well." And a little comedic relief because I don't know who takes that news very well, but I think he needed to be shocked into saying something. And we were all shocked. I don't think anyone's prepared to hear those words. And the fear is indescribable. It's overwhelming at first. And so you go through all the motions. I had a double mastectomy. I went through 8 rounds of chemo. I had reconstructive surgery, and you're finally getting to the end of it. And as my dear friend and coworker Robin Roberts told me, see, that's when the real fear sets in, because now you have the fear of recurrence. And I'll never forget when my surgeon asked me, many of us survivors are offered, and I still do, every 6 months you go and get your blood tested. They look for tumor markers to see if your cancer has returned. And my surgeon said to me, "Are you sure that you want to do this and invest in this, like every 6 months, going and coming into the cancer center and being reminded?" And I said, "Well, yeah, I mean, of course I want to come in every 6 months." And she said, "I just say that to you because it doesn't really impact the end result." And I hadn't really let it sink in my brain at that point because I was just in fight mode that if it comes back, if I get a tumor marker, that's stage 4 metastatic breast cancer. And it dawned on me what she was saying. It's a terminal condition. So would you rather have the years not knowing? Or would you rather, spend time knowing that you're dying? And that is when the real fear hit me. And that is when I knew that I had to do something more. And I had to give back in a bigger, larger way. And I once heard someone say there is a cure for cancer. It's called cash. And cash and funding leads to research. And research is how we're going to find our way out of this mess. I want to hold my grandchildren. I want to, grow old. I want to have the opportunity that I know millions of other women and men who've been diagnosed with this disease want to know is ahead of them. And it is through research that gave me the drugs I'm on today, tamoxifen. I know that's going to give me the best chance at survival and at least a few more great years if it does happen to come back, because, by the way, 30% of all early-stage breast cancer patients will go on to develop stage 4 metastatic breast cancer, and we have to do better than that. And BCRF is doing just that. They also, we were just backstage talking to another breast cancer survivor who was the recipient of Herceptin, another breakthrough, brilliant drug that is saving lives, extending lives, that BCRF had a hand in helping create. Because I will say this right now, research and BCRF is the reason why I just celebrated my 5-year cancerversary this past October. Yeah, round of applause. Research and BCRF is the reason why there are more than 3.5 million breast cancer survivors in the United States today. That is a remarkable number because research is the reason why breast cancer deaths have decreased 40% in the past 25 years. And that is a remarkable thing. I know that I am so proud to serve as an ambassador for BCRF, to do what I can. Yes, I like to raise awareness and let women know and men know that it is through making those appointments, keeping those appointments, and putting your health first that we can help prevent later stage breast cancers, because the earlier you know, the better chance you have at survival. But in the meantime, I applaud all of these researchers who are collaborating through the funding and help of BCRF to do better, to find better ways to cure this disease, to make cancer not a terminal one, but one that is chronic, one that we can live with, one that we can treat and grow old with. And that, I believe, we are going to see that day soon, because this year alone, I mentioned that there's a cure to cancer. It's called cash. Listen to this number. It's staggering. BCRF has awarded $63 million in grants to support the work of nearly 300 scientists at leading medical and academic institutions across 14 countries, making BCRF the largest private funder of breast cancer research worldwide. That is amazing. How about another round of applause for that? But there is so much more work to do, because we still have those statistics we don't like to read, but we need to know. Every 2 minutes, a woman in this country is diagnosed with breast cancer. This year, more than 250,000 people will be diagnosed with breast cancer in this country alone. And unfortunately, this year, more than 40,000 people will die of breast cancer, and we have to do better. Breast cancer is the most common cancer affecting women in the world, and second most common right here in the United States. You know, the truth is, I will always live with fear. That fear is right here. But I use that fear as a pinch me moment, a reminder to live, a reminder to live better, to do better, to give back, and to live with gratitude. And that's something that is perhaps the one gift of cancer. I know that fear is motivating, and I'm motivated to defy it. I'm motivated to make this world a better place, and through giving back, through BCRF, we're doing just that, and I'm very proud of it. And I think that one of the things that you are just searching for, reaching for when you get a diagnosis like cancer is hope. Hope. And it seems futile sometimes in moments when you're at your lowest, but BCRF gives women and men around the world hope. And that is why I am so grateful for everything they've done and all that they will continue to do. So thank you for your time this afternoon. Have a great day.